Hi, I'm Dr. Dan. Today we're going to be talking about an alternative to what most of you probably have heard of chiropractic, where you're pressing in, getting those loud pops, clicks, and cracks. The method that we use is called activator methods. It uses this tool called an activator to do that into the joint to stimulate the nerves surrounding that joint. Basically, we take a look at the leg length to start. As you can see on this patient, her right leg appears shorter. That's due to neurological imbalances within her spine. So the primary job of this is to correct those so that her feet line up straight. And then we determine the type of adjustment she needs from seeing if this leg gets longer as we move into position 2 like this compared to position 1. We start at the feet, move our way all the way up the spine to the head. We start by checking the knees. And I'm looking for the feet to even out at this point, because by swiping in a particular direction, the body responds. If that direction is good for the body, it will even out the feet, and that's how I know where to adjust. On this patient, her legs remained uneven, so then we move on to the pelvis. And that evened out. So then we adjust the pelvis at 3 points. Go back to double check. It's still out, so we check the other side. It evens up. Once the pelvis is clear, we check the sacrum. Can you squeeze your knees together and relax? So we're checking for different rotations and angles that the sacrum is aligned in. Next, we move on to the lower back. And this is sort of, as Simon says, with the patient, having them do specific actions which correspond to each particular level. Can you place your right arm on your lower back? Switch arms. So with this one, I'm looking for the feet to become uneven, because after we cleared the pelvis, they were even. So now at each point, I'm looking for the changes. So when they're uneven, that's how I know which level to adjust. Put both arms on your lower back. Both arms down. And raise your right hip up and down. So we found 3 levels that need to be corrected and stimulated. And the legs are even again. So now we check the thoracic spine, the middle of the back. Place your right arm above your head. Bring it back down. Place your left arm above your head. And back down. And both arms above your head. And back down. So again, there we found 2 levels. And the activator has 4 different strengths or levels that we choose. There are bigger vertebrae in the lumbar spine, so we need a larger setting. And with the mid-back, it has all the rib attachments, so we need to get those as well. Turn your head to the right. Raise your right shoulder up and down. Shrug both shoulders down. Place your left arm above your head. Switch arms. Arm back down. And turn your head back to the center. We also want to check the scapulas or the shoulder blades. So I'm moving them in a particular direction because I've treated this patient before. I know which direction is going to be out on her because typically it happens again and again and again. Lift your head up and down. Move your chin down to your chest and relax. Press your face down into the table. Turn your head to the right and move your chin up away from your shoulder. Move your chin down towards your shoulder. And turn your head to the left. Back to the middle. So in this part, we're actually working on the neck. You notice I'm not twisting her neck. I'm not putting it in any positions that may be uncomfortable, especially if she was in a lot of pain. This is a very safe procedure, especially if you're worried about different positions that a chiropractor may put you in. And we take a look at the body as a whole versus just focusing on specific levels where you may have pain. So that completes a scan of the whole body. We've looked at her from her feet to her head. Her legs are now even. You can see that when they started out with the right leg being much shorter, and she's done her treatment.